I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on the Hepatitis A vaccine is part of a series of videos giving information on commonly recommended vaccinations. This video is intended to supply general information. For specific decisions about your health, you should always talk with your own personal doctor. Now, the hepatitis A virus causes acute inflammation of the liver. That means that the liver's function becomes disrupted over a short time span as the body tries to fight off the virus. Since the liver is important as an organ for making the proteins and enzymes that we need to live, the infection caused by hepatitis A can make a person very ill. So it's good that there is an effective vaccine that can prevent this serious infectious illness. Let me tell you more about the illness caused by the hepatitis A infection, then I'll discuss the vaccine. First, it would be good to clear up any confusion caused by the fact that there are three kinds of infectious hepatitis viruses that you may commonly hear about. All three are named by letters: hepatitis A, hepatitis B, and, you guessed it, hepatitis C. Yet these are very different viruses, so I'm discussing the hepatitis B vaccine in a separate video segment. Unfortunately, there is no vaccine yet available to prevent hepatitis C. The hepatitis A virus usually enters the body through food or water contaminated with the virus. Now, only humans get this virus, and the virus exits an infected person's body through the bowel movement. So this is not usually passed by kissing or coughing. Rather, it is caused by eating or drinking something where a tiny part of an infected person's bowel movement has contaminated it. That sounds gross, I know, but unfortunately it happens fairly commonly. One way is if a food handler, such as a cook, doesn't wash their hands well after using the restroom. Another way is if fruits and vegetables are irrigated with water contaminated with human feces. That can easily happen in countries where public sanitation is not as good as it is in the U.S. For instance, fresh produce imported from Mexico to your local grocery market could rarely be contaminated from the water used to irrigate it while it was growing in the Mexican farm field. That is why it is important to wash all produce and fruit with clean water before using them. Also, cooking foods does thoroughly destroy the virus. Once the virus gets into a person, it takes about 4 weeks for the person to become ill. Usually the infected person develops fever, tiredness, lack of appetite, nausea, abdominal pain over a couple of days. Then the urine gets dark, the bowel movement gets lighter than normal in color, and the skin turns yellow-orange, which is called jaundiced. The infected person usually feels ill for 1 to 2 months, and then usually recovers completely. Even though recovery is likely, I certainly would not want to get the hepatitis A illness. Now, it turns out that some people who get this virus have their immune systems fight off the virus without feeling sick. The odds of not feeling sick are directly related to age. 70% of children younger than 6 years don't get sick with a viral infection, but less than 30% of older children and adults are that fortunate. Not surprisingly, the hepatitis A virus can cause complications in some people. Before the vaccine came out, about 100 people per year in the U.S. died of severe liver disease from the hepatitis A virus. This was more common if the infected person was over 40 years old. Also, there are a lot of costs and physical suffering associated with this infection. 11 to 22% of infected people have to be hospitalized, and adults miss an average of 5 weeks from work. There's no specific treatment to get over the hepatitis A virus faster. It's much better to get the vaccine and reduce the likelihood of ever getting this disease. Does the vaccine work? Well, prior to the routine use of the vaccine around the year 2000, hepatitis A caused up to 30 to 60,000 symptomatic infections each year in the U.S. That decreased to 2,000 infections in 2009. That's a huge drop. A lot of people have been saved from having this serious illness by the widespread use of this vaccine. The hepatitis A vaccine is given into the muscle by a shot. There is no live virus in the vaccine. It is now part of the routine vaccination schedule for children. The first dose is recommended at ages 12 to 18 months of age, with a booster given about 6 months later. Close to 100% of people develop protective immunity from this vaccine. Now, hepatitis A vaccine is not recommended for every adult. However, many older children and adults should consider receiving the protection of the hepatitis A vaccine if they have not already had it. The largest group would be people traveling to poorer, less developed countries where sewage treatment and food preparation hygiene may not meet U.S. standards. This is basically all areas of the world outside the U.S. except Canada, Western Europe, Japan, New Zealand, and Australia. For instance, before my wife and I went on a trip to Brazil, we made certain to get this vaccine. Now, if you are planning to travel to a risky country, then get the first dose of vaccine as soon as you know you're going. One dose is considered protective, but don't forget to get the booster dose 6 months later to build up protection that will last many more years. Other people who should consider hepatitis A vaccination include those in close contact with an adopted child from a country where hepatitis A is common, healthcare workers like myself, men who have sex with men, people who use illegal drugs, people who have a blood clotting disorder, and people with chronic liver disease, such as having hepatitis B or C infection. The hepatitis A vaccine is very safe. Mild and self-limited reactions at the injection site, such as pain, redness, and swelling, are reported by 20 to 50% of recipients. Fewer than 10% of people complain of mild fatigue or low-grade fever. No serious adverse events have been reported. There are a few reasons to skip this vaccine. The major reason would be if there was a severe allergic reaction to a prior dose of the vaccine or to a vaccine component. A moderate or severe acute illness, such as influenza, would be a reason to postpone routine vaccination for a couple of weeks. But people with a mild illness, like a common cold, need not postpone receiving the vaccine. The vaccine has not been tested during pregnancy, but its theoretical risk is quite low. You can review more information about the hepatitis A vaccine at www.cdc.gov/vaccines. I derived much of the information for this talk from the Pink Book article on the vaccine at the CDC website. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Another website with excellent information is that of the Immunization Action Coalition at www.vaccineinformation.org. Hepatitis A infection is a really lousy way to spend a month or two of your life. It can be prevented. I hope that you will protect yourself and your loved ones with the hepatitis A vaccine.